If they ask you prophylaxis of gas gangrene, please write prevention and treatment, okay, because there's not much to write here in prevention. Prevention, there is active vaccine, they are still in discovery stage. Against the alpha toxin, it is still in experimental stage in animals, okay. Then coming to treatment, if a person you think is infected, then you can give antibiotics. After checking the susceptibility, you can do that. Hyperbaric oxygen, because in oxygen environment they cannot survive, the bacteria, these are anaerobic bacteria. Passive immunization with the antitoxins, okay, with antitoxins you can give antitoxin, anti-alpha toxin, anti-serum you can give, anti-alpha toxin, and okay, you can give. Then you can give antibiotics. Did I tell you the names? Antibiotics you can give penicillin, clindamycin, okay. Then you can do early surgery. It is crucial step, okay, it's a crucial step in management of gas gangrene. All devitalized tissue should be resected so as to remove conditions that produce anaerobic environment. Closure of wound should be delayed, okay, because you should not give anaerobic condition, right? Got it right? So if they ask prophylaxis, write this entire thing. So I hope you have understood gas gangrene. There's a lot that you can learn and write for gas gangrene, caused by Clostridium perfringens or Clostridium welchi mainly, okay. It can also have Clostridium novi, Clostridium septicum, and a lot of other Clostridia also, okay. Clinical manifestations, we already told you: sudden pain, rapidly increasing foul smell, gas bubbles or crepitus, edema, induration, liquefied or sloughed off tissue, shock or organ failure can occur, higher mortality rate, 50%. Lab diagnosis, we have told you: collect the specimen like necrotic tissue, muscle fragments, exudates from deeper part of wound. Do direct microscopy under gram stain. You should see like something like these. You will see gram positive bacilli. Culture media, you will use Robertson cooked meat broth. Egg yolk agar, you can see Nigler's reaction. Culture, you can use incubation like gas pack in anoxomat you can do. Main thing you should know is biochemical tests. Also you can include biochemical tests like it ferments lactose by producing acid and gas. We have seen in litmus milk, right? So to identify these strains, we have 4 things: target hemolysis, Nagler's reaction, reverse Camp test, heat tolerance test, and litmus milk. This one is target hemolysis. This one is Nagler's reaction, very important for exam. This one is reverse Camp test. Nagler's reaction, opalescence surrounding the streak line in egg yolk agar. Here you can see the opalescence. Here there is no opalescence because anti-alpha toxin was put there. This test can be positive for many types of Clostridium because many of them make alpha toxin like Clostridium perfringens, Clostridium bifermentans, Clostridium barrati, Clostridium sordelli. So it is not a very specific test for Clostridium perfringens. Got it right? Then you have to draw these diagrams, please note. Reverse Camp test, you will put Clostridium perfringens on blood agar and perpendicular to it you will put group B streptococci. You will see an arrow shaped attenuated zone of hemolysis which is pointing towards the Clostridium perfringens. This is butterfly appearance or arrow appearance you can say. This you will get only after leaving it for 2 days, right? 2 days at 37 degrees centigrade, normal room temperature. Then there were two other things. Heat tolerance test will be positive. It can tolerate up to 45 degrees centigrade in Robertson cooked meat media. Litmus milk, you will see clot, stormy clot, because it ferments lactose producing acid and gas. Gas gangrene prevention, there is no vaccination as such. You should just keep when you fall or you have trauma, you should make sure that you clean the wound. That's all I would say. If there's trauma, you have to clean the wound, because the soil, whatever is there, could pick up, right, the bacteria. Treatment, antibiotics like penicillin, clindamycin for gas gangrene, hyperbaric oxygen. This hyperbaric oxygen, I think a little more I have to tell you. Hold on. Hyperbaric oxygen may kill the obligate anaerobic Clostridia. However, it has no effect on aerotolerant Clostridia. That was about hyperbaric oxygen. Passive immunization, you can give anti-alpha toxin. Early surgery is actually recommended. It's a crucial step, and you should also delay the closure of wound so that you will not create anaerobic environment. Okay, bye-bye.